So in today's video, we're going to be comparing Rexulti or brexpiprazole and Abilify or aripiprazole. And these two medications have very similar actions. So we're going to get into a deep dive and compare these two medications so that you can determine which of these is right for you. So let's get into it. Starting with number one, how do they work? So how does Rexulti and Abilify work? Well, they're both partial agonists of dopamine and serotonin. So they can turn up and turn down those receptor sites or those neurotransmitters when needed in certain areas of the brain to help boost mood and cognition and improve symptoms of mainly schizophrenia and major depressive disorder. They're also both classified as atypical antipsychotics or second generation antipsychotics, and some will say third generation antipsychotics. However, if you look at these two comparisons of the binding sites of each of these, you'll see that brexpiprazole actually has less partial agonism on the D2 receptors when compared to Abilify. And in fact, brexpiprazole acts more of an antagonist than it does an agonist. So it's going to work a little harder to turn dopamine down rather than turn it all the way up. And this is actually effective for helping to reduce those motor side effects or even akathisia that's seen with some of the first generation and some of the other atypical antipsychotics, and even what's seen with Abilify. Now, as you can see here, you also notice that brexpiprazole has more potent action on the serotonin 2A or 5-HT2A, 5-HT1A, and the alpha 1B receptors. And this contributes to brexpiprazole's overall antidepressant properties, and which is why brexpiprazole in clinical trials seem to have more antidepressant effects than aripiprazole. However, there are no head-to-head studies on the effects or side effect profiles of these two medications. So we're just looking at what the clinical trials say of each of them and comparing them. And so we'll also see that Abilify has greater action on the histamine blocking sites or the H1 receptors. And this attributes to more somnolence or sedation and perhaps even more weight gain when comparing Abilify and Rexulti. And so that brings us to the second point of what they are actually used for. Well, Abilify was first approved in 2002, and it's approved for schizophrenia in adults as well as adolescents 13 and older. It's also approved for bipolar 1 disorder and specifically manic and mixed manic episodes, as well as with bipolar in adults and pediatric patients 10 years old and older. Abilify is also approved for major depressive disorder as an adjunct therapy, so when adding it to an antidepressant, as well as approved for irritability associated with autism spectrum disorders in the pediatric population of 6 years to 17 years old. It's also approved for vocal and motor tics that are associated with Tourette syndrome, and this is for the pediatric population of 6 to 18 years old. And now when we look at Rexulti was approved later in 2015 for the treatment of major depressive disorder as an adjunct to your antidepressants, as well as for schizophrenia in patients 13 years and older. However, it was also approved in 2023 for the treatment of decreasing agitation in patients with dementia associated with Alzheimer's disease. And this had some controversy around it, which I discussed in the video on Rexulti. So if you missed that video, go ahead and check it out. However, there is still the risk of increased mortality, and so that's where the controversy lies. Now, that brings us to talking about side effects. What are the side effects? So when comparing the common side effects, so I'm not looking at every single side effect, just the common ones of Abilify and Rexulti, you'll see that the common side effects associated with Abilify will notice akathisia, restlessness, or insomnia, which is typically associated with higher dosages and more with that akathisia side effect. And then in lower dosages, you'll notice more sedation or somnolence. And you'll also potentially get weight gain with Abilify. Now, when we're looking at Rexulti, some of the common side effects noted with Rexulti include weight gain as well, somnolence or sedation, and akathisia. Also then with Alzheimer's patients, in the later studies, they noted nasopharyngitis, which is like cold symptoms with a sore throat and maybe a runny nose, as well as some dizziness. Now, when we break this down in percentages, when we look at akathisia with Abilify, you'll notice that there's a variable difference here of 8 to 25% of patients who take Abilify may experience this akathisia, which is very uncomfortable restlessness and agitation, where patients who have this will actually pace back and forth, and just have to be constantly moving. And so this was also noted to be dose dependent, meaning the higher the dose, the more risk of the akathisia. Akathisia with Rexulti is also dose dependent and was seen in 4 to 14%. So there is a reduction there of akathisia with Rexulti, or a reduced risk of akathisia with Rexulti. Now, when it comes to weight gain, there are many variables to this as well. And with Rexulti, we saw about 10 to 30% of patients reported an increase in their weight of greater than 7% of their total weight. And this led to a weight gain of anywhere from 2 to 7 pounds. And then with Abilify, there was some variability as well of 2 to 26%. So we're not seeing too much difference there with weight gain. So I'm not sure if the less action on histamine blocking that Rexulti has actually results in less weight gain. And then when it comes to sexual dysfunction, neither of the FDA labels report any percentages on sexual dysfunction. And I just mentioned that because I know some of you have concerns about sexual dysfunction, and particularly with SSRIs or some of the antidepressants. But antipsychotics don't have a lot of reports on sexual dysfunction. And then I also want to mention that they both have the risk of metabolic syndrome, and this is where you have the increased weight gain, or you may or may not have the increased weight gain, but you may also get high blood sugar, high cholesterol, or lipids, and so therefore it's very important to get your labs checked. And now some other things to consider with both of these medications is the fact that they both contain the black box warning for suicidal ideation. Anytime you're combining a medication with an antidepressant or a medication that has antidepressant effects, that is a warning. And this is typically seen in patients of the age of 24 years and younger. And then you also have the black box warning for both of these medications for increased mortality or death associated with cerebral vascular accidents or stroke. And this is seen in primarily patients with Alzheimer's or dementia, or the elderly patients greater than 65 years old. So in that regard, you have to weigh the risk versus the benefit. Other considerations to think about are some of these rare side effects that can occur, like neuroleptic malignant syndrome, which is a medical emergency, which I talk about in some of the other antipsychotic videos, the tardive dyskinesia, the involuntary movements of the face, and this pathological gambling, which seems to be a subset side effect specific to brexpiprazole and aripiprazole. So that's just something to think about or consider, especially if you're taking it for impulsive behaviors. You want to make sure that it's not contributing to increased impulsive behavior, and specifically with gambling. However, if this is noted, sometimes they found that you can reduce this effect by reducing the dose of the medication. Then you have to look at your white blood cells, because there can be dyscrasias or abnormalities of your white blood cells. Making sure that you're getting your labs checked, that's very important. As well as checking your blood pressure, as orthostatic hypotension, which is a drop in blood pressure when you stand up too quickly, or syncope, which is fainting, can occur with either of these medications. And so a tip that I like to tell my patients, especially those who are older than 65, is to sit up on the side of the bed, dangle your feet, and get the blood flow to your brain before you get up in the morning. Also, both of these medications can reduce the seizure threshold, making you more prone to seizures. So this has to be taken into consideration if you already have a risk for seizures or are taking other medications that can decrease the seizure threshold. So talk about this if you're concerned with your provider. And so what are my final thoughts on Rexulti versus Abilify? Well, both have been shown to really help improve major depressive symptoms when used adjunctively to treat major depressive disorder. And this is primarily how I use these types of medications. However, as I mentioned in the video on Rexulti, I do not like to fall back on medications only, and I take a step back and do a bio-individual approach to treating patients with depression, anxiety, or any other mental health illness, and try to look deeper for the root causes before adding more medications, because that's where you can actually get into trouble. However, these medications can be very effective and helpful for some people. And so when you're looking at both of these and comparing them and you're thinking, which one should I take? Obviously, it sounds like Rexulti is actually going to give you perhaps better antidepressant effects, as well as decreasing your risk for that akathisia. So if you've tried aripiprazole or Abilify and you've experienced that akathisia and you were turned off by it, but maybe it was helping your depression, perhaps Rexulti could be a next best option for you to try, as it can reduce that side effect. However, when you are doing this comparison, at this point in time, Rexulti is still branded and aripiprazole is still generic, meaning Rexulti is actually going to cost you more than Abilify. And if you don't have insurance, you're going to pay quite a bit to try and get Rexulti. Now, if you have insurance, you may have to jump through a couple of hoops to get Rexulti approved. But bottom line is that Abilify is going to be cheaper in the long run for you at this point in time. So when it comes down to cost and you haven't tried either of these, you probably want to start with Abilify first. So there you have it. That wraps up my overview on Rexulti versus Abilify. Have you had experience with taking either of these medications? If so, drop it down in the comment section below, because we learn from sharing each other's experiences. And as always, I thank you for watching. I wish you well on your mental health care journey, and I'll look forward to seeing you all next week.